You know, if you're experiencing, pain, burning, tingling, numbness, and any other bad feelings in your feet, could be a sign of neuropathy, and you definitely want to get it treated as quickly as possible. Well, today we're on the offices of Dr. Sonia Spencer over here on Pass Road in Gulfport. It's a pleasure to see you always.
Thank you, Jim.
It's good to see you. Now, we've talked about so many different things that you treat, but one of them specialties is neuropathy. And that's something that, people that are dealing with that kind of situation should get treated as quickly as possible.
Yes, Jim, they should. And it's important to begin with a proper diagnosis of finding out whether or not you really truly have neuropathy. Neuropathy generally begins in the feet with burning, numbness, tingling. A lot of times patients come in and they can't stand the covers on their feet. They have burning, severe pain that starts in their feet. They may have diabetes. They may have taken some medication that brought on these types of symptoms in their feet. They may have a history of drinking every night, maybe not have alcoholism or something like that, but maybe have a couple of drinks every night that may have brought this on. They may have had chemotherapy. There's a lot of different causes of neuropathy, but it is important to get diagnosed and get treated. And what we offer here is drug-free treatment for the symptoms of neuropathy. Neuropathy has no cure, but what we do is help heal the nerves that cause the pain of neuropathy through our Class 4 laser. It's a Summous laser, and it's really neat how it works because some of the medications that they give for neuropathy have very severe side effects. And one of the things people come in with is that, they're having trouble walking, they can't feel their feet already, and some of the medications can really cause confusion and really add to some of the symptoms. Even though it's helping with the pain,
right,
it has a lot of side effects. So this is a drug-free treatment. It's all natural, no drugs, no surgery, no negative side effects, and it's 90% effective at reducing the symptoms of neuropathy without drugs and surgery.
That's amazing.
It is amazing. So it's a very simple procedure. We use this little wand right here on these large nerves in your body, and I'm going to get a little chart and show you how this works. Okay.
Okay.
All right. So we're talking about peripheral neuropathy. Can you see this okay?
Mm-hmm.
All right. So these are the large nerves that come out of the back right here. So in neuropathy, what happens is these nerves in the feet down here begin to die. And it's very, very painful. Okay? So you see the nerve starts up here and it goes all the way down into the feet.
Right.
So that's a long way to communicate, right? It's a very, very large nerve.
Unless you're a short person.
It's still a long way, okay? Very, very large nerve. So what this laser does is we begin to turn on where the nerve starts, right up here in the back, and we go all the way down. And when we treat these nerves, we go all the way down from the place where they originate, all the way down into the buttock, all the way down the leg, all the way down till we get to the toes on both sides. Because generally when a person has neuropathy, the pain, the numbness, the tingling, the lack of feeling is present on both sides.
Right.
And so we treat both sides of the body. And what this laser does is it helps bring nutrients in, take waste products out. So gently over time, these nerves can begin to heal at a much faster rate than the body has been able to do on its own, because if they were capable of healing, they would be healing. But because generally diabetes and things like that, the person's nerves have been damaged faster than the body could heal them.
Right.
They may be getting poor circulation, their blood sugar may have been out of control for years before they knew they were diabetic. They may have been drinking heavily for a long period of their life. They may have had chemotherapy, which damaged these nerves. And then some patients I've had were dancers or athletes, you know, and they were on their feet a lot in poor shoes, and, you know, they just damaged the nerves in their feet from that.
Wow, I would never have thought about the dancers or anything.
Yeah, so I've been doing this for a number of years, so after practicing, and that's why they call it a practice, after
Right.
practicing for a while, you get to see what some of the variables are, because I've had patients come in that said, I'm not a diabetic, I've never drank, I haven't had chemotherapy, I don't know why this has shown up in my life. So I think about 60% of patients that get this are diabetic, you know, and then there's about 20% of those that are chemotherapy induced, and about 10% of them are, you know, unknown origin. So trying to figure out, you know, what is that, you know, unknown, where did those cases come from?
Right, right.
And so I've identified that a lot of those were either dancers or athletes. So Kayla's going to tell you a little story about a case that we have from one of our really hardcore cases. The patient was really suicidal.
A lot of patients come in and I do a lot of the interviewing for Dr. Spencer before the patient even sees Dr. Spencer. And this patient specifically, he came in with very severe burning, numbness, tingling in his legs and his feet, talking about wanting to amputate his legs off. He wanted to cut them off. He couldn't deal with the pain no more. And so after about 8 weeks of treatment, he was so happy. It was just so rewarding to see how far he came from day one to today. Not today, but sorry, until his end. And it was just so rewarding. And then he called us a few weeks later telling us how he's going on cruises, walking around, just enjoying life with a better quality of life.
Doesn't that feel rewarding
It
to
does.
you when you
It
see
makes
experiences
us,
like that?
does. It makes us so excited when we get phone calls back from those patients. It's just so rewarding to see them. He didn't have to amputate his legs. He's doing great, still doing great. So that's very rewarding.
What a great story.
It's a great story, and this is one of the most rewarding things we do in our office. And it's not covered by insurance. I do want to say that, but it is very affordable. Most of our patients end up getting care credit so that they can finance it out, and it's very affordable with care credit. And we do offer interest-free financing with care credit so that patients can afford to get the care they need, kind of like going to the dentist and finding out you need a root canal or something like that.
Oh yeah, been there, done that.
Yeah, you can't always just pay for something like that, but it's very worth it to get the care you need.
Definitely. So if you are suffering from neuropathy, or not sure if it's neuropathy or not, or know someone you know, give them a call here at Spencer Chiropractic. They're located on Pass Road in Gulfport, and right across from the street from Pass Road Elementary.